I recently did a video on the WHO's designated #1 cause of disability throughout the world, depression. So that was just an article, and more of an editorial type article printed in JAMA. So I looked up the WHO document itself and went through some of the details on it. It actually started to get into some of the details around diagnosis of depression, the impact on the individual, of course, the increased risk among women. And guess what? Less than half of people are treated worldwide, and in some countries, less than 10%. Despite the fact there is very effective treatment. There's also very effective screening and prevention. So we'll talk about that in just a minute, but first my brief introduction. My name is Ford Brewer, F-O-R-D, Brewer, B-R-E-W-E-R. This is the Prevention Channel. We work on helping you understand how to prevent the major causes of death and disability. Believe it or not, depression is also a major cause of death due to suicide. So let's talk about depression a little bit more in the WHO document on it. First, just a couple of other reminder about a couple of facts on it. #1 cause of disability worldwide, over 300 million people. Women were 1.5 times more likely than men to have depression. It's a major cause of mortality through suicide, and effective treatments are just not being used. Just a brief aside, and we may get to a couple of videos later on anxiety. Anxiety is the #2 cause of mental health problems and the #6 cause of disability, with over 260 million people with anxiety worldwide. Just like depression, women are more likely to have anxiety than men. Anxiety, you've heard things like post-traumatic stress disorder and generalized anxiety. Again, these are things that impact your ability to function in your role in the home, at the workplace, and in life in general. So, let's talk about depression for just a second. It's not just a temporary depressed mood. It is a major cause of, again, inability to function. It causes great suffering, disability. When you think about it, again, not just a temporary mood, you have to have over 2 weeks of depressed mood. You tend to have what's called anhedonia. Hedonism is total, I'll break it down to give you the definition. Hedonism is just focus on enjoyment, and hedonism is you can't enjoy anything. Again, you talk to these people and they say, well, yeah, I used to enjoy reading, but I haven't done that in a while. Or I used to enjoy running or walking, and I just haven't felt like doing that. In other words, they're not doing what they enjoy doing and what they have enjoyed in the past. There's actually a physical reason for that. That you say, well, you know, this is soft science. No, it's not. There's actually a nucleus. I'm not sure if it's the ventromedial nucleus. There's a nucleus in the brain. It's the reward nucleus, and that nucleus is not firing. If you look at it, that is the actual physical mechanism for depression and obviously anhedonia. Neurovegetative signs, we'll talk about those in just a minute. Now, depression can be related to, and is often, increased risk associated with life events, poverty, job loss, death of a family member, illness. And speaking of illness, many people think of this as the cardiovascular channel. Cardiovascular disease is a major risk factor for depression. And guess what? A lot of people think of this as the diabetes channel or insulin resistance channel. insulin resistance and diabetes are major risk factors associated with depression. If there weren't so many topics to cover, I would think about covering that specific item. There's a lot of literature out there on the link between diabetes, insulin resistance, and depression. Now, what are neurovegetative signs? They're the signs that sleep, activity, and appetite. And yeah, you'll talk to people with, and these things can go in a bunch of different ways. For example, somebody can just say, I can't sleep at all. Or they can say, I go to sleep, I'll wake up in the middle of the night, I can't go back to sleep. I toss and turn all night. Others will say, all I do is just sleep and sleep and sleep. I can't wake up. Regarding appetite, again, the same sort of thing. It's not just you see total loss of appetite. Sometimes you see people say, I keep eating, I'm gaining weight, I can't stop. Or I want to eat something in the morning and then I don't want to eat anything the rest of the day. Or I'll just take a few bites and I'm not hungry anymore. Activity, the same thing. Sometimes overactivity, sometimes underactivity. Just a major change in the activity patterns in life. Now, what's tragic is that there are effective treatments, cognitive behavioral therapy, medications, counseling therapy. I'll cover those in another video, but here's the major point on this issue. Less than half of the people worldwide are getting any of the major treatments. Now, there's a whole bunch of reasons why. If you look at some countries, less than 10% of people with depression are getting these effective treatments. Here are some of the barriers. Lack of doctors, lack of other healthcare people, doctors, nurses, people to see patients. Even in the U.S., you're getting a significant decrease in the number of primary care docs able to see baby boomers. Lack of psychiatrists, lack of counselors, other mental health providers. There's social stigma. Who wants to admit that they've got depression? Some people do, but a lot of people don't. It's called denial. Inadequate screening. I mentioned earlier a thing called the PHQ-9, and again, I hope to cover that in a future video. It's a great, simple way that primary care docs, if your primary care doc is not using a PHQ-9, and also the malnutrition survey, if your doc is not doing that, tell him to use it. I would say find a new doc, but there's just not enough docs around that know how to do that. Again, docs are just not doing the preventive work they need to be doing. Other causes of lack of access to the effective treatments for depression, misdiagnosis. We've already talked about how and why. Well, quite often people say, "Well, it's just a mood issue." So there'll be a diagnosis there, and they don't get it. They think it's something else. On the other hand, often you'll see one of the most common medications classes given in the U.S. is SSRIs. It's a depression medication, and quite often it's given for the wrong thing. It's given for mood. It's given for personality disorders and other issues. Again, we got a mess out there. Thank you very much for your interest.